Hello, my name is Dr. Vance Kirar, and I'm the Clinic Director for Kirar Superior Healthcare. We've been taking care of our community here for 21 years, and I want to tell you about a fantastic new technology called non-surgical spinal decompression. If you've been diagnosed with degenerative joint disease, degenerative disc disease, osteoarthritis, bulging or herniated discs, maybe you have sciatic neuralgia and pain traveling down into your legs, maybe you have numbness or tingling in your hands or arms, maybe you have disc herniations in your neck, non-surgical spinal decompression may be able to help you. Now you may be wondering, how do we customize the table for your specific injury? Whether you're dealing with disc bulges or disc herniations, chronic neck pain or whiplash, radiation of pain down in the legs and feet known as sciatic neuralgia, or degenerative joint and degenerative disc disease. Alright, so what we have here is our doc decompression table. And what we can do is we can customize this table specifically for the areas of your spine that we want to create that oscillation and decompress the disc bulges or the disc herniations. So we can go right into the lumbar spine and we can isolate L5S1, L4, L5, L3, L4, and we can work all the way up in the lumbar spine. We also can do this for the cervical spine as well. So whether you're dealing with disc bulges or disc herniations in the lumbar spine or disc bulges or disc herniations in the cervical spine, we can address both of those areas. So we can do different techniques depending on how we need to isolate the actual disc. And it creates an oscillation effect that again creates that negative vacuum force that brings the disc back in its proper position, takes the stress and strain off the soft tissue of the disc, and allows for the disc bulges and disc herniations to heal. We have our very wonderful patient, Miss Cindy. And Miss Cindy, can you tell me what it's like to be on the table, what you notice?
Well, first of all, it's very comfortable. It's not anything to be afraid of. It's so comfortable, and the whole process when you're on the table is very relaxing. And to be honest with you, I usually fall asleep. I was having, mainly I was having really bad left sciatica that was going down my left leg all the way to my foot. Even though I have disc issues in my lower back, herniated disc at L4, L5, and S1. My lower back really wasn't the problem. It was more going down my hip. And oh my gosh, the first time I had decompression, it relieved the pain. It was phenomenal. And I feel great when I walk out of here.
For somebody who was a little bit tentative about non-surgical spinal decompression, what would you tell them?
I would tell them to trust Dr. Vance and his team. That, oh my gosh, I can't rave enough about the decompression. I wish I could come actually I wish I could come every day. That's how wonderful it is. All right, so what we have here is a vertebral spinal segment, and we have the two vertebrae of the spine, and in between we have the disc. Now when we're looking at the disc, we also have the very delicate nerve roots that are in yellow here. And in the back of the vertebra, we have the facet joints. The facet joints, the nerve roots, and the disc all can produce pain. And so different things that injure the disc, things like heavy lifting, slips and falls, car accidents, repetitive lifting and twisting can cause injury to the disc, and you could have a disc bulge or a disc herniation. That causes pressure and irritation on the nerve. Now doctors will tell you that you have degenerative joint or degenerative disc disease, or you have a slip disc or a disc bulge or a disc herniation, but this is what's causing the pain on the nerve that may radiate down into the arms or the hands or even down into the legs or the feet. A lot of our patients suffer with sciatic neuralgia, and this is typically a cause of that. So what we have is a non-surgical spinal decompression table that takes the pressure and irritation off the disc and creates an oscillation or a pumping action in the disc that allows the disc to heal. Now in our office, we're going to sit down and we're going to go over your exam findings. We'll go over the MRIs and we'll explain exactly what the problem is with the discs.
We'll talk to you about how we're going to isolate those injuries to the disc and reverse the negative effect so your body can heal the way it was designed. So whether you're dealing with disc bulges, disc herniations, facet impaction, or just sciatic neuralgia, we can help. For more information, look us up online at drkirar.com. I look forward to helping you.